Assalamu alaikum wa rahmatullahi wa barakatuh. A very good evening. Welcome back. This is Health Matters, channel 347 on DSTV platform, ITV networks. Always a pleasure having you welcome me into your living room, into your home, wherever you're watching us live. The four corners of the world, across the lands and the beautiful seas. ITV networks is where you need to connect with .tv and click on live stream. So just quickly understanding that we know the pandemic has come and gone, have you? No, it has absolutely not gone. It's going to be here for quite a bit. This virus is real. COVID-19 is here. And yes, things have maybe slowed down, and in some areas in South Africa, it has gone up. But we still need to understand the possibility of a second wave. It could come tomorrow, next week, next month. And that's what we're going to talk about today. Our specialist online will help us understand it, advise us, and allow us to please know to follow the rules. So today's show, the possible second wave and how we're going to get through this summer holidays. As we know, most of the countries are experiencing winter as well. So they had gone through their second wave and they're busy experiencing it and how they're going through it. Watch the news. Don't become too paranoid about the ideas and the facts, but also to keep yourself ready. Most of our COVID-19 survivors had said, but I've done all I needed to do. Followed safe distance. I social distance, I didn't go out when I was supposed to, I wore a mask, but yet I still got it. So please, in today, start tomorrow, protect yourself and take the necessary vitamins and keep yourself healthy. But of course, to update us on South Africa's stats is our newsroom, and please have a look at this video. We now welcome Imam Saeed for our weekly wellness. We now welcome Imam Saeed, our life coach, who we reached out to during the hard lockdown, during Ramadan. Very happy to get hold of him once again. Alhamdulillah, Imam Saeed, always a pleasure having you back on air with us. Assalamu alaikum, and how are you doing?
Wa alaikum assalam wa rahmatullahi wa barakatuh. Doing very well. And I hope that you and the listeners are doing very well.
Yes, definitely. There is the warning out for possible second wave, and today's topic is all about that. If we could just start off from you, how things have been going with regards to, the actual lockdown, the hard lockdown, the ease now, level 1, being implemented right up until next day, inshallah. Tell us about your environment and what have you been dealing with because of lockdown?
It has never been easy. It has been difficult because of the corona. It's like, you have things that you're used to be doing, change in normalcy. You're so used to doing things in a certain way. Now you have to start to adjust. It gets frustrating. People get anxious. People get depressed. I've seen long queues by the post office where people have to come and start collecting stipends during the lockdown. I've seen compliance and non-compliance of wearing masks and using sanitizer. It has been a disaster, to tell you the truth.
Okay, so people not necessarily following the rules and understanding. What do you think is going through their minds when they are thinking, oh no, this pandemic is not real, I'm not going to wear my mask, I'm not going to sanitize? What is really happening with their mind frame, their whole set of understanding with the pandemic?
The thing is, there is different groups of people when it comes to any type of pandemic, any news, anything coming through the TV or radio, whatever the case is. In this case here, you'll find that there is a group of people that will say, this is what we have heard. There is a pandemic out there, and we've been warned against it, and we've been told how to deal with it, and they just follow suit. And then there's people who think probably this is a conspiracy theory, and I'm not going to follow all this here. I'm not going to sanitize. I'm not going to wear a mask. I'm not going to social distance. And we have a group of people that this is the group of people that really struggle, mentally, because they are caught in between complying to the rules and surviving. So, I'll give you the example of you find there's people who are on the queues. Today, I just saw people on the queues at the post office waiting for this 350 Rand stipend. And when you look at them, you find that these people are not social distancing. Some of them are not even wearing masks, and there's no one to monitor these people like in other malls where you have security guards monitoring these people to wear masks. So what is going through this group of people is they're not more worried about the safety needs. They're more worried about, I just want to get this money, and I want to take care of myself, and I want to take care of my family. You find in a group of people, if we have to interview them, you find probably there's people who have lost their jobs, or people who have lost their salaries, and people who are just struggling generally because Corona is out there. It brings to mind another psychological theory that was brought in by a man called Abraham Maslow. I don't know if you've heard about it. And this theory, Abraham Maslow, he actually said that we have different type of needs, and he put them in a tire, or he put them in different tires, or he put them in a pyramid. So he says that at the bottom there we got physiological needs, which means we got food needs, water, warmth, rest. These are the basic needs. And he says that as long as the needs on the lower tier of the hierarchy are not met, a person cannot proceed to the second tier of the hierarchy. So you find here in this case that people are struggling with food, for example, because of the salaries are cut, or because they've lost their job, for example, and now they go into the queues, or now they go in, find some form of way of getting sustenance, and now they're not worried about the second tier, wearing of masks and sanitizers and social distancing comes in, because those are safety needs. They are more worried about, I want to take care of myself. I want to have good food on the table. I want to get that stipend. I want to get that money from the government, and that's it. So for them to be worrying about the safety needs, the social distancing and sanitizing in the situation, it's not happening to this group of people. And I think this is a majority of the people in the country right now, if I have to assess it that way. So these are some of the challenges people are going through right now. And the other major issue is because you find the people going into these groups because they have not been prepared for this. People have not been educated about this. People have not been expecting something like the COVID-19 coming, and we have to get used to wearing masks and sanitizing and social distancing. It's something that people are not used to. So if you look at it from the people who are not who are well-to-do, for example, you find the difference in them coping, because they have the lower tier of their needs met. Like we're talking about the food and the shelter, and they have that met. So for them to really take care of the mental health becomes very easy for them to worry about that. Another thing is the stigma among the different cultures of people in the country concerning mental health. We have this type of stigma where mental health is not important. We think it's not important. You find when you talk to people generally in other communities about mental health, that you have to go and meet a psychologist, a psychiatrist, whatever the case is, and talk about your mental health. They don't worry about that. So people, they don't realize how much mental fatigue they are going through because of COVID-19, but they just worried about what can I do to get food for today and tomorrow and the other day. So this is majority. I'm emphasizing on this because I think this is the majority of the people in the country who are actually struggling going through the COVID-19 right now.
So Imam Saeed, what I'm picking up here is that mental fatigue is leading people to possibly not think straight, to make rash decisions. What do we need to understand of those that doesn't firstly recognize their mental fatigue, and how it's actually going to affect their life and the life of others, possibly the loved ones closest to them?
People need to be educated, and I'm not sure if this is the right time to educate them, because It's like you want to tell someone about a storm, you want to educate them about the effects of a storm, and we are already in the midst of a storm. This is what is happening. So I've been talking to a lot of people, and you find that people are fatigued. You find even students are fatigued mentally because now they have the pressure to go through a syllabus which has been changed because of the COVID-19. So at this moment, I'm not sure if we will do much by educating people about taking care of their mental health, about taking care of their general health, following the rules. I actually believe that if people don't not follow these rules, they're gonna get more mentally fatigued. If people don't sanitize and wear the mask and do what needs to be done, there is more mental fatigue coming, especially with the second wave. How is that? Because more people are going to get more affected with corona. And when people are affected, it's going to affect their families. It's going to affect their livelihoods. It's going to affect their children going to school. It's going to affect the families. More lives are going to be lost. And we're going to be more and more fatigued mentally. And people have to realize that this is COVID-19 is not a joke, and it's there, and it's not going to affect us only, just by getting the symptoms. It's going to affect us also mentally. It's going to affect everybody as a society as well. But we have to do whatever we can. As Muslims, I can just say that we have to start educating people from the mimbar. The imams have to do this. If we have mental health activists, they have to do this. Doctors have to start educating people about the seriousness of this virus. We have to talk to people about this from the mimbar, from the masjid, from the Islamic centers. The Islamic centers and the masjids should not become centers only of talking about dawah in the deen of Islam. We should talk about this. This is serious, and it's connected to our deen because it's connected to the well-being of not only Muslims, but humanity at large.
Absolutely. We have a responsibility against humanity, for humanity. Imam Saeed, certified life coach, public speaker, author. We understand your passion in psychotherapy and in psychology. We've literally got 30 seconds quickly to wrap up. Your message to those that are fearing the second wave.
If the second wave has to come, because there is a big possibility that it has to come, please let's not ignore our mental health. People usually forget this part of the mental health generally, and with the COVID-19, people are not understanding that COVID-19 is actually causing more of the mental fatigue, and we have to learn coping skills. If there's something that we have to learn, we have to learn coping skills, and we have to honor our mental health needs and not ignore them. And as we watch news and listen to the news, we must not be paranoid. At the same time, we must strike a balance. We must not be paranoid and get too much scared of what's happening. Otherwise, we're going to be in more trouble than we expect. We're going to be in more trouble than we know. Very important. Let's just follow the rules. Let's be safe. Because if I save my own life, Corona is not about saving only myself. It's saving the next person and the next person and the next person. So let's do this. Let's be responsible as Muslims and as human beings as well. And maybe you never know one or two or three things that you can do. You can save yourself and save humanity. And Allah subhanahu wa ta'ala is going to reward you for that.
Apt words, and well said by a local imam and student of psychology, life coach, Imam Saeed. We always appreciate your time, Jazakallah, for pointing out, what is most important during this pandemic. Inshallah, may Allah increase you and always be available to our community. Inshallah, benefits absolutely to our society. Assalamu alaikum to you, and enjoy the rest of your day. There we have it, Imam Saeed. Please do connect with him. He is an astoundingly life coach and is there to support those that are in need. And Imam, a big role he plays in society. We need to chat to our COVID-19 survivor just after this. Assalamu alaikum and welcome back to our special edition of the second wave. South Africa could see a possible second wave. We have seen other countries experiencing it, going through it and getting through it. So let's do our part to not get there. And how are you going to cope during the summer holidays? Every week we speak to our COVID-19 survivor. There are many that have survived this pandemic, this condition, this virus that is out there, but there are many that also has lost their lives. Lots of sad stories, so let us understand and appreciate those that have lost their loved ones close to them, not able to go to their janazas, not able to see them, touch them, hear from them in the last minutes of their life, passing away and succumbing to COVID-19. So let's please spare a thought for them, prayers, and understand how the family has been affected by it. Very, very different way of losing a loved one. But on the flip side, we have survivors telling us their stories to help us possibly prepare ourselves or get through our current COVID-19 status. We now welcome Riaz Beg. Assalamu alaikum to you, Riaz, and welcome to ITV.
Wa alaikum salam wa rahmatullahi wa barakatuh.
You're the youngest of 7 children. We appreciate your time. So quite an experience you had as well with COVID-19. Originally from Johannesburg, I am jealous that you find yourself in Cape Town, my mother city, alhamdulillah. Tell us, Riaz, how did your story start? Some of the symptoms, when you were diagnosed, and how you dealt with that.
Basically, Nazreen, my wife's one of the critical staff fighting COVID. She's in the medical profession, and she's actually part of the trauma unit in Cape Town. So from the word go, we anticipated that there could be a possibility of us coming across the strain of COVID. And yeah, on the 12th of June, my wife tested positive. We immediately then went into isolation. And on the 15th of June, myself and my son, Uzair, tested positive as well. In my immediate household, I've got myself, my wife, and 3 boys. My eldest son, Abdudayan, and my youngest, Zahid, tested on the Tuesday, and they tested negative. So out of 5 people in my home, 3 of us was positive, and 2 of us was negative.
How did you cope with that, having to separate yourself from your family, those being positive and negative? I understand with in some households, they actually had to remove those individuals that were negative. Was that the case with you, and how did you guys cope with that separation?
Nazreen, first of all, just getting results back stating, in my family, we were the first to test positive.
Okay.
So that put my entire family in a flat spin. Everybody was calling. It was like a death sentence. People were thinking that, bidding farewell, calling, very concerned. And in my household, we initially thought we'd separate our family and move my 2 kids out of the household. And then we decided not to be a family, we'll face it head on. All of us took medication and we stayed indoors, and we helped one another through the difficult times.
You were diagnosed at the heart of the pandemic, the lockdown that happened, and the crazy spike that also happened in Cape Town. And as you said, you were not surprised when you and your wife had contracted the virus. She was an essential worker, so she needed to be out. Often people are saying, I protected myself, I did the necessary. Was there any doubt with those rules that you were following, and yet you still got it?
Nazreen, we did everything under the sun to possibly stay safe.
Yeah.
We followed all the rules, did whatever we needed to do, and we were very cautious for the mere fact that my wife was in the medical profession. And yet, having taken all those precautions, we still ended up contracting the virus. So the message out there is, people say as long as you take the precautions, you're 100% safe. You're never 100% safe.
So in that light, said Riaz, I'm trying to understand, people's reactions and why they are doing the things that they're doing by not, protecting themselves and saying, you know what, if I get it, I get it. What is your understanding and what is your thoughts around people like that? Because like you said, you protect yourself, but you're not really 100% protected. So for those people taking that risk to say, oh, okay, you know what, I don't really need to wear a mask, and when I get it, I get it. But as a member of society and as a Muslim, what is your thoughts around that?
I think, it is our responsibility, not only to ourselves and our family, but to our communities as well, to act responsibly. We need to take the necessary precautions, do whatever we can, and go the extra mile. Only when you have that message come to you that says you have now tested positive does the reality dawn. We all say tie the camel, do the precautions, but in reality, when that message comes and says you as an individual has now tested positive, your whole world collapses. Because now, as a father, you question the possible impact to your family, your possible impact to your wife, your kids, your community, everybody else. So my wife was devastated when she got her results. 2 days later, when we tested positive, you then sit back and you then realize, you know what, this is the reality. This is what is out there, and now we have to face it. And only once you have to face those challenges does the reality set in. And the people out there that has the opinion or look at it from the perspective of they might be able to just avoid this thing will only understand the true impact of the virus once somebody in the immediate household or somebody in the immediate family has been affected.
Let's talk about some of your low moments. Was there any for you or even your wife experiencing that you're just thinking that, am I getting over this, the separation of my family, me being an essential worker, or even for yourself, were there any low moments for you, and how did you get over it?
During the lockdown period is several low moments. You locked in your household where there's no movement in terms of taking a break, going outside, taking a breath of air. It's all enclosed, and spending all that time in confined just awakens all those thoughts. What is the next step? What am I going to do? And a lot of our time was spent as a family in resorting to dhikr, making sure we recite, keeping those things that kept us focused. And on those low moments, we turned to one another for comfort. And ultimately, we had a very good family structure. Family would be calling us on video call. We had phenomenal friends that had food and stuff dropped off at our house. I really saw my family and extended family and good friends go the extra mile. All those things was a phenomenal assistance during this dire times.
What were some of the medications that assisted and helped you, and how is it prescribed? Your wife being in the medical fraternity, so understanding what could help, what is good for you. What were some of the medications you guys were on?
That was a whole host of things. We started off the prescribed medication, antibiotics and Augmentin and the flu stuff and the cough mixtures prescribed by the doctors. And then we opened up to a host of other things, from home remedies where you had to have ginger with lemon, honey, and turmeric. Another thing that we used on the daily was a Chinese ginger tea that consists of ginger with lemon and honey as well. And we consumed large amounts of black seed oil, and just lots of fluids.
How long did your isolation period work, and how did it affect your wife's work hours or her going back to work, or even your working experience? Is it something that you needed to? Were you able to work from home? How long was your isolation period exactly?
Lockdown was a terrible time for everybody. Me being a consultant, I'm a risk consultant for companies, brokers, and individuals. So all consultancy work basically came to a grinding halt at the end of February. Over and above that, I would still have one or two clients that would require services during lockdown. But going through lockdown and specifically COVID, work takes a backseat. The entire focus is on keeping a positive outlook, trying to recover and get through the period. We had a incubation period of about 12 to 14 days.
Okay.
And during that time, even my wife was pushed to the limits, because in her profession, she has to be at work to maintain a unit. So it was very difficult, extremely difficult.
Riaz Beg, thank you so much for sharing your story. We've got probably like 20 seconds to wrap up. What is your message in light of the possible second wave that South Africa could experience to, those that have had not experienced COVID-19 yet?
I would reach out to everybody out there and say, we as South Africans, as brothers, as sisters, as Muslims, as the wider community, should generate that awareness, come together, support the people that's going through this. Because once you've experienced the detriment of COVID, or even the hurt and agony of losing family or friends or close ones, you will only realize the seriousness of this epidemic.
Absolutely. Riaz Beg, to you and your family, Jazakallah, and big shukran for sharing your story, shedding light on the experience of another COVID-19 survivor. All the best to your wife. And one of the warriors, you married to one of the warriors of the universe at the moment, standing out and doing their part on the front line of this war of pandemic called COVID-19. We appreciate your time, Riaz. All the best to you and your family. Stay strong and stay well, and continue spreading the message. Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
There we have it. We feature every week a COVID-19 survivor. If you'd like to tell us your story, please do connect with us via our WhatsApp line or call our office hour number. And we've got various other social pages that you can connect with us. Next up, we talk to our specialist within the industry of the second wave and this pandemic of COVID-19. Back in a moment. Assalamu alaikum wa rahmatullah. Welcome back to our show as we tackle the second wave. We now speak to specialist at the NICD, Acting Executive Director, and we also understand that there's now an official statement out with regards to the second wave. Let's chat to Professor Adrian. A very good day to you, Professor Adrian, and thank you so much for joining us on ITV's Health Matters.
Thank you for the opportunity, and to your viewers as well. Thank you.
Only a pleasure. So the minister has made an official announcement that the second wave is upon us. It's present. What happens now, especially in the context of NICD? There's been many tests that has rolled out previously. So what's going to happen now?
Well, what has to take place is that there is a resurgence plan, and the resurgence plan has two components to it: the alert and the response plan. And during the alert phase is that what we were monitoring the numbers of cases, and they certainly declined through the, I suppose, the level 2 and partly level 1. But then we started seeing cases in the Western Cape and the Eastern Cape. And that's when we have to put those particular plans in. And the plans are around, as you quite rightly say, they're around the laboratory, the epidemiology, they're about leadership, they're about managing our hospitals and making sure that the hospitals are ready. and also that our communities are ready as well. So communications are really central. So there are several pillars around the resurgence plan to try and really make sure that we can actually, again, flatten that particular curve. But you can see that the numbers of cases have certainly increased quite dramatically over the last few days. And one of those causes for that are obviously the so-called super spreader events, which certainly allow for people to congregate in large numbers, come into close contact in the absence of the non-pharmaceutical interventions that allows for spread to occur. Once those individuals move back into their communities, they then certainly are able to spread the virus as well. So there's much to do. So I think we need to really face up to the fact that it's, again, in our hands how we manage this particular second wave or surge.
So the announcement of the second wave and the surge, spike, immense increase, does this now mean that the pandemic is not under control at this present moment? And why is that? You've mentioned one possible super spreader. Other possibilities.
So the reasons for continuous spread, obviously, is that we in South Africa have never really been able to really suppress transmission in South Africa. From the very beginning, even though we had a severe lockdown, followed by a risk-adjusted lockdown, I think the difficulties within our communities is that we're really finding it really difficult to implement the non-pharmaceutical interventions. That includes, for example, mass gatherings or events where large numbers congregate, ventilation. These particular aspects have certainly contributed and could continue to contribute to what we are currently seeing. I think, but it's not different to what we've seen in Europe or the United States, for example. Even though they had the summer, we thought, oh, the virus will certainly dissipate and we'll see the end of the virus. It continued. And similarly here in South Africa, the virus has not gone away. It's here, it is being transmitted, and we need to try and see how we can manage this particular second wave or resurgence.
In your opinion, and looking at some of the gatherings and the community South Africans' reactions to the disease, we are hearing things of them saying, "Oh, we don't see the pandemic; it's not real to us. The effects of it is not that bad. It hasn't happened to us. We don't know anybody that has died or been affected badly by it." You know, these sort of statements are clearly showing that South Africans are not taking it serious enough. How is it that we are meant to keep the spread at bay with these thoughts and just their thinking in respect?
So as part of this resurgent plan is really around risk communication again and engaging the community. You're quite right. I think there has been, oh, this is just the flu. I think for the majority of people who are in a particular age categories, the disease is a fairly mild disease and they are able to survive that and come relatively unscathed. However, we do know, we've seen this in Europe and the United States, there's the so-called long COVID as well. So people who have survived may well actually have some other sequelae as a result of these particular infections. And you're right, people don't see the death and the overwhelmed situation, but I think we really need to become aware that we've seen this happen again in the Eastern Cape, is that our hospital facilities, whether those be the wards or the ICUs, are overwhelmed. Our healthcare workers become infected as a result of not always having access to PPE. So these are really critical things that we really need to be aware of, and people die. So again, in intergenerational families, again, spread is possible, and if there are comorbidities such as obesity, hypertension, respiratory disease, cardiac disease, these are all vulnerabilities that can lead to really being people ending up in our hospitals, ending up in the ICUs and overwhelming our particular systems, yes.
So we understand this virus has been around for almost a year now, and it is novel, and yet it's still new. Has there any changes come about since the first wave? Have we learned anything from other countries? Anything new that we need to know and be aware of with regards to COVID-19?
So I think that the virus is certainly evolving, but not to the point where I think that we're saying that the virus has become, if you like, more virulent. I think that a large amount of work has gone into understanding this particular virus. It's incredible to see the number of publications, whether they be peer or non-peer reviewed. And so we're understanding a bit more about the virus than we would usually do, but we don't think it's more virulent. But we have also understand a bit more about the immunology, and we've seen the breakthroughs with the vaccines. We understand a bit more about the fact that we do have antibody responses as well as so-called cytotoxic T cells. So our immune systems are responding to this particular virus. But on the other hand, there are those individuals who've become infected, but actually after a period of time have become reinfected. So there are all these particular really fascinating and important challenges and problems that this virus does present.
Let's look at the vaccine. Where is South Africa or Africa at currently with the vaccine?
Yeah, so as I said, it's been fantastic. It's been phenomenal to see that we've been able to achieve a vaccine within such a short space of time. The vaccine that has certainly been licensed, at least in the UK, has its own particular challenges from a logistics perspective. So I think for South Africa, the introduction of such a vaccine may be well challenging, and we may have to wait for vaccines that have less challenging logistical requirements. However, our concern is that when will that vaccine become available? Because remember, this vaccine, even though it's been successful and assessed by other regulatory authorities, still needs to go through our own South African regulatory authority. And then it's a matter of saying, well, what is our priority list for that particular vaccine, and who will receive it, and when will we receive that particular vaccine? So I think there's still a bit of time before South Africa can see a vaccine being in circulation. So it comes back to all these points that we've been talking about over the last few months. The non-pharmaceutical interventions are in our hands. That's what we have currently, and that's what we have to make use of.
Yeah, no, this is something that we implement and we talk about on a daily basis when going to do our essential shoppings. There are precautions in place, the non-pharmaceutical methods, as you've mentioned, wearing a mask, not allowing anybody. I was actually recently at a outlet, and people refuse to wear a mask. So, you know, it's not to say it's a certain class, it's a certain individual that wants to do it. They're even saying, like, I've got asthma, I cannot wear a mask. And these are the people that needs to be protected. What is your opinion around that?
Yeah, so you're right. I think our communication strategy and our understanding of that resistance, because you can just imagine when the vaccine comes, what resistance we may even encounter there. I think it's really important to see how we can engage people. And perhaps, you know, under those circumstances, we may have to look at where to target our interventions as well. I think, you know, we may well not succeed in terms of the wearing of the mask, but will we be able to succeed, for example, in preventing the congregation of large numbers of people, for example, to ensure that the distancing occurs, that there's good ventilation, that events occur outdoors. Perhaps those are the areas that we may well have to focus, but I think we still really need to focus on trying to get people to, it's a new culture, a new way of the way in which we have to conduct ourselves. And I think those are really critical for us to try and see how we can change those particular attitudes. Difficult.
If we look at again, we don't want to move back. In fact, we want to move forward and prevent a hard lockdown. But how can we practice a possible hard lockdown for ourselves and you know, within our family and our communities, initiate something to protect others and to, you know, not allow super spreaders to take place? So how can we keep safe this summer?
Yeah, so I always think about safety bubbles. We don't talk about it often in South Africa, but I think we should start talking about the fact that if you are in a safety bubble, as a family, for example, or as a unit, where you know what the movements are and what the risks are and how to manage those risks, it's when you come into contact with other bubbles, should you be coming into contact with those bubbles, and if you do, how do you manage those particular risks? Again, it's keeping down the numbers. It's again, practicing the physical distancing is really critical, and wearing of masks, again, is still really critical. So I think small groups, safe distancing, ventilation, those are, in my mind, the way in which we as families can actually manage this particular epidemic.
We talk more with Professor Adrian, Acting Executive Director for the NICD, after this, as we find ourselves currently as South Africans in our second wave. Back in a moment. Welcome back. A very good evening. Assalamu alaikum. We as South Africans need, please, asseblief, kanala, all those words that we want to say to get the message through, those non-pharmaceutical methods, wearing the mask, sanitizing, keep little bottles in your bag, give it to your children if you have to go out. And as Professor Adrian, Acting Executive Director for the NICD, has mentioned, that we can do it as a family, as communities, to not at least to prevent the spreading of this and bring down that spike. Let's chat further with Professor Adrian. Welcome back, sir. Let's now look at how we can perceive our second wave. Is it possible for South Africans to have a relatively small second wave, like Italy maybe had, and they were, big in the news, it really hit them hard? And how can we do that, to have a small second wave?
Yes, I think that's going to be the big challenge. I think just looking at the numbers, though, they're certainly going quite steeply. So I think that's going to really be a challenge for us to try and really, we talked often about flattening this particular curve, and I think we didn't quite achieve that in the first surge. I'm a bit skeptical that we will be able to do that in the second surge, but it's come back to the points that you've raised, that I've raised, consistently, that we really need to try and ensure that we can really become used to these non-pharmaceutical interventions and really try and ensure that we are safe. I think you raised the point about what has changed, or what are the advances around this particular virus. And certainly from the medical treatment perspective as well, that certainly has provided us with certain advantages in terms of our knowledge around with treatment of high oxygen flow, for example, pronation, the use of dexamethasone. So in terms of treating individuals, I think there are certainly advantages, but people need to get to hospital soon enough. So I think it's really our being aware of our signs and symptoms and getting tested as soon as possible. Also, if you have symptoms that are suggestive of COVID virus, get tested, but also go into isolation or at least quarantine as well. That's also really critical. If you have been tested and test positive, you need to be in isolation in order not to transmit this particular virus to others. So isolation, quarantine, the tracing and tracking. So again, there are apparently apps that are available for us to try and alert those around of us if we've been in settings where there has been COVID cases identified, so that if you were in that particular scenario, have symptoms, test, that you can actually inform others that you actually, that not you personally, but that there is an infection in that area, that there needs to be action around either isolation or quarantining as well. So these are some of the things I think that we can certainly try and prevent the spread of this particular virus and the severe sequelae, especially those that have comorbidities. I think that's really critical. Our homes are vulnerable. Our care homes are vulnerable. So how do we protect those? That's really going to be important.
I was reading a recent statement from government, and immediately the doctor, instead of the patient, asking questions of severely, bad diabetes patients with very strong comorbidities, and understanding that, he needs to be protected and how he needs to handle COVID-19, walks in the doctor's surgery, and the first thing he wants to know, doctor, are we handling COVID-19 correctly? Is it under control? Am I safe sitting here, coming out, and I need to see you? I know that there were various modes of communication with doctors, but we have been allowed to come out, so people are going more and more to doctors. So there is that concern around people, going out, attending events, and at the end of the day, we're saying, listen, let's not have the events. But the events are still happening because our president is saying, listen, we can have them. They are limited, so people are still going to have them. Let's talk about how we need to protect ourselves at those events. What sort of questions should we be asking ourselves and others? And not be afraid to talk about it when you see somebody not following the rules, maybe.
So that's one of the hard ones. So I think really, if I want to attend an event, do I know what this event is about? What are the numbers that are going to be there? Is there going to be good physical spacing? Is there going to be ventilation? What are the numbers? Is this event going to be overcatered for in terms of the numbers and so forth? That puts me at risk. And is it an event that I really need to be at? So I think those risk assessments are going to be very important. Are you in an area, for example, a district or sub-district where there is already high levels of transmission? So high levels of transmission, an event that has large numbers of people attending, where it's going to be difficult to manage physical distancing, ventilation, the wearing of masks and so forth. If in your mind, that puts you and or others that want to attend this event at risk, I would advise not to attend those particular events.
Okay, so understanding, and we've had great privilege of interviewing at least once a week a COVID-19 survivor, and it was very interesting to hear these stories. But what came out the most for me was importantly was how they were protecting their relatives, their other family members, even in the household. Some even said that they removed their mom and dad out of the house. Some said they were completely isolated. So let's look at when they do get it. A lot of them had mentioned, if not all of them, have said, I protected myself, I wore a mask, I sanitized, I'm not even sure how I got it. What do you say to people like that? And also to those that saying, oh no, I had it already, I don't need to protect myself.
Yeah, so I prefer the character who says, I've had it, but I want to protect myself and I want to protect others. How am I going to do that? I'm going to be wearing a mask. I'm going to do all the things that a person who has not been infected does, such as wearing my mask, being physically distant, washing hands, high hygiene, ventilation. Because again, those people who have had it may have it again. I know that currently our knowledge is not of the best, but there are still risks that people who have been infected will become reinfected. And there are at least some documented cases around that. So it's really critical that people who have been infected actually still practice all the key things that they may not have done previously, but are actually having to do again. So that, again, we come to those non-pharmaceutical interventions need to be practiced all the time, consistently. Wear the mask consistently, for example, physically distance consistently, hand hygiene. Those are all really key important steps, even if you have been infected. Because I think, again, we're all in this together. It's in our hands.
Absolutely. Professor Adrian, Acting Executive Director for the NICD, you've got your fingers in virology, some surveillance studies as well, epidemiology, and understanding the whole concept of this virus. A lot of us are still not au fait with all of those medical terms. And when we do get into it, I know I had a guest on not too long ago, she's in IT, but she follows everything. But she's not that, crazy and getting, making herself, as they say, too aware of it and driving yourself crazy. But it's an interesting fact. So when we look at the study of this virus, and you've said, yes, it's novel, it's changing, it's not, but we all need to learn from it. What are the basics that we are still needing to understand about it? You've mentioned that it's not just the flu. We've had interviews where people are saying that I'm just not the same again after I've recovered. I'm still out of breath. I'm actually having a little bit of symptoms of still not being able to taste or smell. So from your experience, anything that does stand out with regards to the virus, some technical information that can help others as well, and moving forward, what we can know about it still?
Yeah, so one of the points you raise is that people have been infected. And I think one of the key things is this going to be an important outcome of this particular virus in terms of the numbers that will experience, or is still called in common parlance, long COVID or the long haulers. Do we sufficiently understand how this virus affects the different systems and what are the consequences of that? I think that's going to be really critical. I think the other critical area is coming back to vaccines again. I think, as I said, it's been extraordinary that we've achieved a vaccine in such a short time, in fact, 3 vaccines. But do we sufficiently understand how these vaccines will work and how they will protect us? And, for example, are there other vaccines that we need to develop in order to have better levels of protection? So there's a whole gamut. As I said, you can sit on your website and read millions of, not millions, but you can certainly read new papers almost every day around this particular virus. It's really fascinating.
Okay, so with our survivors, we were chatting about, and I want to latch onto that, because at the end of the day, if we do, they didn't say if I have it. The reality is when I have it. Everybody's going to get it. We were also possibly looking at herd immunity, and the doctors was I know they were uproared about the idea of opening the taxi ranks, and I must say it was controlled really well. Some mentioned even the possible vaccines that South Africans already had that helped them survive COVID-19. What is your opinion around that, and how do we take this forward to protect ourselves, continuously protect ourselves, not just non-pharmaceutical interventions, but by diet, but by the necessary health, having a healthy lifestyle and taking that into consideration?
Yes, I think if you're in a position to look after yourself, or in the community where that does happen, I think that's going to be very important. But communities that are struggling, for example, it's really going to be very difficult around immunity, for example, to ensure that. I have read 1 or 2 of the papers around previous exposures and how they may assist. Again, I must admit, I'm not fully convinced, but we'll see that the studies are there and are ongoing. For example, the use of the BCG vaccine to determine whether or not that will be protective. We will see what those particular results are. Coming back to your point about nutrition, so again, there's some evidence that, for example, vitamin D may be very important. So yes, I think dietary, food intake, looking after oneself psychologically, these are all really important matters that need to be addressed. And of course, as you know, in South Africa, we have a very fragile health system, and in order to take care of our larger communities, I think will be a critical and demanding requirement.
Lastly, Professor Adrian, we have a minute to wrap up. It is summer holidays, so lots and lots of families are going to hit the beach and the sand and just enjoy the sun. Anything that they need to know when they are in their isolated family little tents, gatherings at the beaches, how do they keep safe in the water and on the sand? And then also just some feedback of how people, again, can connect. You mentioned the app, a helpline number, WhatsApp, and all of that.
Yeah, so I'm not very good at these. So I think I sent you a link to the NICD,
okay.
so you can
we'll
certainly go onto that
yeah.
and have a look at the different publications. If people really want to understand a bit more about the disease and know the numbers, then I think the NICD website is really critical. The Department of Health has certainly released an app, but again, I really would like to encourage everyone to access and to use, not to be afraid about Big Brother watching. I think the idea is to help us out in this particular, contact tracing is really challenging. And if this app can help us to find who's infected and to put them in quarantine, to put them in isolation, again, it's not thinking about that one single individual, it's thinking about all those individuals. So when you're on that beach, with your family and in the safe bubble, you really want to make sure that they're safe. So again, the NPIs, non-pharmaceutical interventions, face, space, hands. Those are the key things that you need to bear in mind all the time as you enjoy the glorious summer weather.
Good way of putting it, Prof. Thank you so much, Professor Adrian, NICD Acting Executive Director. All the best. You keep safe and be well, and take it easy this summer holidays if you do get a break. All the best. Goodbye.
Thank you very much. Thank you for the opportunity.
Only a pleasure. There we have it. And he said it well. What did it say? Safe, space, hands, face. Space, hands, face, space. I hope I got that one right. Thank you so much to the team at the NICD for doing their bit, and the rest of you that are continuing to follow your social distancing, stay at home, wearing your mask, your visor, your protective non-pharmaceutical intervention, sanitizing, and sanitizing. Remember that one. This virus is not going anywhere, but thank you so much for being part of it. Join us for the next Health Matters from my team here in Johannesburg and myself. Wassalamu alaikum and goodbye for now.